Again for this fourth Friday webinar. This time we're talking mental health and COVID-19. I don't know if anyone saw the statistics, but it looks like we've unfortunately suffered from our 50,000th death due to the coronavirus pandemic in the United States. I know, for example, a stat I saw maybe 2 minutes before logging into the call that Georgia alone has 22,000 cases and they have 888 deaths. And this is with the impending opening of that state. So I just want to start off with those sombering statistics before we get into this conversation, once again led by the woman I'm turning it over to, the incomparable Keeys.
Thank you so much, Brandon. I'm really excited to be here once again with the NMQF team. You all have been doing a fabulous job just queuing up these conversations and keeping a pulse on what's going on in the nation, and also just really hearing and receiving words from our audiences to glean what it is that will be helpful to you in this time. And so for that reason, I'm especially excited and grateful to be having and uplifting a conversation today on mental health. All of us are predominantly sheltering in place where we are. Some of us are with family and loved ones. Others of us are by ourselves and trying to virtually connect. And then we have our frontline healthcare professionals who are really battling it out, and then they're going home to their own situations. And so we're going to break into all of that in terms of immediate implications for our mental health with respect to COVID-19, and then we'll talk about some long-term things. And here today to help us with these discussions are two esteemed people who I hold near and dear to my heart. I think highly of them both personally and professionally. I'm truly grateful that they're here with us today. Joining us, we have Ms. Lanata Williams, soon to be Dr. Lanata Williams. She serves as the CEO of Alliance Family Solutions, very good sister girl, and she's going to bring the real for you today. So we're grateful for Lanata's presence. We also have with us today Dr. Frank Clark, who is an incredible mental health provider. He's going to talk to us today. He serves as the medical director and division chief for adult inpatient and consultant liaison services for the Department of Psychiatry and Behavioral Medicine at Prisma Health. And even though we are presenting adults, I also hope that, especially given that both Dr. Clark and Lanata are parents, we can also, and I have 1,000,000,001 nieces and nephews, we can talk a little bit about mental health as it relates to children and young people. So let's go ahead and just get into it. I want to go ahead and throw a question to both of the panelists, and audience members. Also keep in mind, we're wanting to interact with you in this conversation. So there will be polls that pop up periodically. Please feel free to address them, answer them, and then also with your questions, if you have questions, please put them into the Q&A box, not into the chat box, okay? All right, so let's go ahead and get into it. So between the two of you, tell us your ideation of mental health and what is it that we're really needing to hold on to or let go of during this COVID-19 pandemic public health crisis. We can start with Lanata. I'm going to put her on the spot.
Perfect. And you know what? I appreciate the cue since we're trying to be very courteous with our digital connection. I really want to thank the Minority Equality Forum for having me, and thank you so much for the wonderful introduction. I think that as we are thinking about mental health, I think that it's okay for us to also acknowledge that there is a cohort of people that really don't have the luxury to sit back and to kind of like ruminate about the subject. And if it's from a scholarly perspective or from even the personal perspective. So I want to just be really sensitive to that and say that our mental health is the way that we take care of ourselves physically, mentally, and emotionally. And a lot of the times when we talk about mental health, we are also talking about the aspect of how we're able to just cope day to day. And some of us call that anxiety. Some of us call that just being able to just live our lives. And when we're embracing the idea that we're now in the pandemic, where lots of people have never addressed their mental health issues. So, you know, we know all the studies and the statistics of people that have gone undiagnosed. So being aware of that. And then we have people that do have a diagnosis. So I think that it's really sensitive just to be aware that there are certain people that are moving throughout life and not defining and talking about themselves from this perspective. And we had a number of people that were already experiencing a lot of disconnections from the divides that we talk about. And when we layer that with the words of social distancing and the other ideas that this pandemic has put us in, it can really be convoluted. So when we talk about mental health, I just want to make sure that some people, you can have a mental health issue without a diagnosis, because millions of people are undiagnosed. And then just understanding that when we also talk about mental health, that it also is from the perspective of how do you just take care of yourself daily? Are you getting enough sleep? Are you drinking enough water? Are you able to go for a walk daily? Are you able to maintain your own self along with others? Because, right now kids are at home, and I'm glad that you mentioned that. Everyone's talking about homeschooling. I'm really using the word that this is crisis schooling. Like, we all signed up to be parents, but a lot of us did not sign up. I did not sign up to be a teacher right now. So we are all in a state where we're trying to scramble and get things together. So we're all experiencing a level of crisis inherently that's been thrust upon us very quickly. So I just wanted to kind of broaden that out and just say the mental health is just how you're taking care of yourself right now and how are you maintaining.
Thank you for that, Lenata. Over to you, Frank.
Thank you, Mia, and I appreciate you guys having me today. It's an honor to be here and serve on this panel. I'm going to steal what one of our former Surgeon Generals said, Dr. David Satcher, when he defined mental health. He talked about mental health is fundamental to health, and I truly believe that. Oftentimes, it's I think we get into this this kind of dichotomy. There's mental health and then there's physical health, and I personally believe that they're connected. Speaking to what Yolanda said, that it's kind of the mind, body, and spirit, and how we take care of ourselves. And so, I think during this time of the pandemic, our world has been kind of turned upside down. We are facing, we're going into uncharted territories. Each day we are trying to feel rejuvenated and have our mind and our spirits renewed. And sometimes that can be difficult, especially when you experience a pandemic that is somewhat foreign to people. We can think about the H1N1 flu. We can think about SARS. We can think about other things, but COVID is a different beast, so to speak. And so I think it is important that we acknowledge how we're feeling. Some people may be going through an identity crisis with this pandemic and trying to think about, okay, who am I in this setting of a crisis? Who was I pre-COVID? Who am I during COVID? And who am I going to be post COVID-19? And so all those things that were mentioned in terms of taking care of ourselves, both spiritually, physically, emotionally, are very important. But without mental health, we don't have health.
I truly appreciate both of you grounding the ideation of mental health in, like you said, in the body, in the spirit, in the mind. And, even if we were to revisit the definition of health that the World Health Organization put out in 1948 about wellness not being merely the absence of infirmity or disease, it truly is the whole beingship of one's spiritual, mental, emotional, physical health. So thank you so much for setting us up in that. And there were some points that you all mentioned, and I took notes, and I'm going to come back to them later on in the conversation. But for the time being, I want us to now move the conversation a bit to our population of interest right now in terms of marginalized and minority communities. I'd like to start with people of color, and more specifically with Black and Brown peoples. And so if you can talk to us anecdotally, and then also with respect to the science, how is COVID-19 in terms of mental health impacting Black and Brown peoples, and then emotionally as well as psychologically? And then if we can follow up with that question and add a layer of intersectionality on top of that, with respect to sexuality status, with respect to disability status, and preferred language. And you can choose to comment on any of those, but let's start there. How's it impacting Black and Brown folk? And either of you can jump in.
Okay, well, I'll definitely say that I appreciate adding the caveat of able-bodiedness, and when we talk about disabilities, and being able to discuss the layer of cultural and linguistic competency that sometimes we tend to ignore. And I know that I'm also at the Department of Behavioral Health here in Washington, D.C. And one of the key things that we have been talking about is, what does this look like for people that are receiving information? A lot of the information that we're receiving about COVID-19 has been through the media, and that is the primary culprit of not having access to people that are non-hearing. So the ASL community has been just kind of like ignored within this. We don't have interpreters that are there to interpret this information. Our other cadres of, people of color, when we think of the Hispanic community, when we don't have things that are in that are translated, and then not even speaking to the quality of the translation, but just making sure that we're even able to address the fact that we're honoring that there are people that are hearing this information that aren't hearing it, that we're not giving them access to the information in the way that represents the population. We do know that the African American community is 13% of the population. However, when we look at people that have a diagnosable mental illness, it goes up to 16%. That is making sure that we don't understand what we don't know about people being able to just know that they have a diagnosis. One thing that I've also noticed with communities of color is that we feel like our mental health is something that we can take on and off. So, for example, I might know that I need to take my medication to function at work. If I'm not going to work, I'm not taking my medication. This is not a time where we need to ignore and to stop your current mental health regimen. So if you have a mental health treatment plan, you need to ascribe to it. Really, at this time, more than ever, this is not a time to forsake that. But as we're looking at that, I think that these conversations around how does this information about COVID-19 transmit and get to other diverse communities? And then with that information, the things that we do know about how we live in the cultural lens of how people adapt. I think when you hear the word social distancing, the first thing you think is, how do I connect and see my family members? So there's a large disconnect. When I say social, I'm thinking about my formal connections, but not my informal connections. So if you tell me to stay away from my coworkers, that's a very clear message. But when you tell me to not see my grandmother or not see my mother, there's a huge disconnect with the information, because we are not thinking that the lens of this physical distancing transmits to our family members. And I see that that's a huge deficit. So I know that that's kind of unpacking a lot of different pieces of it, but I think just within the vastness and the diversity of how we approach these topics, culturally, there's so many different ways that people get inside and outside of information. It's not transmitting. And I think that people that are living with an intellectual disability, and for example, people that are non-neurotypical, people that are living with autism, it's a very hard concept to be able to describe not having interactions or the level of times and numbers that you have to wash your hands. So we have to be mindful and start to think about what kind of information those communities need and make it adaptable.
Along those lines, what I have found initially when this whole pandemic started, especially in communities of color and the Black community, I remember a colleague telling me that her parents were attending a church service, and the pastor mentioned that Black people are immune to COVID. We don't get COVID-19, and I kind of had this incredulous look on my face of why would a pastor say that? And then I had to think back about how we as Black and brown folks, how the church and this communities of faith or faith communities are important to us. And you know, we talked about how this information is being disseminated. Obviously, we know that that is a myth. We know that COVID-19 doesn't discriminate. It doesn't care about your race, your sexual identity. But we do know that the social determinants of health disparities, that is why we are seeing the death rate among Black and brown communities rise. I'm from Chicago, a proud Chicagoan, born and raised on the South Side. And I can see, even though I practice in South Carolina, I've been keeping up with the statistics in my hometown. And the last time I checked the statistics, we know that African Americans, we make up about 1/3 of Chicago's population in Illinois, but in terms of deaths in Chicago, we've accounted for about 70%. That's a huge disparity. And so we can't go around disseminating information that is erroneous. We have to be honest and show some integrity when we're talking to our communities, whether they be the Hispanic community, the Native American communities. We mentioned individuals with intellectual disabilities, the LGBTQ community, and so many other communities, of saying this is what is happening with COVID-19, and this is how, and this is how it can impact our overall health. So the messaging is important, I would agree, and then making sure that we are having forums, but mostly that's going to be virtual now, obviously, because we can't congregate in the buildings that we are used to congregating in, whether that be the hair salons, the barbershops, faith communities. We have to think outside the box. And I agree too that, you know, the social distancing concept, in some ways it has a negative connotation, because we weren't created to be in isolation. We were created to fellowship, to have that connectedness. And so physical distancing, I think, is the more appropriate term that we should be using when we are talking to our communities, so that they can understand, hey, you can go still see grandma and grandpa and anyone else that you find that you are close with, but just be mindful of how this pandemic is impacting our health, and take the right measures so that we can flatten the curve, but also we can, you know, improve the health of our communities.
So I want to bring in the audience a little bit here, and then pivot and talk about frontline workers. But before I do, so for our audience, you can just answer this poll. It'll come up on the screen. Let us know, what's your role in the healthcare industry. We want to just get a sense of where you fall, whether academia, administration, advocacy. If you're a frontline practitioner, do you represent a pharmaceutical company? Are you in policy or other? And we'll go ahead and we'll all answer that. And it's multiple choice. You can select several. We'll give a couple more seconds for that to come in. And as those data are coming in, the question I want to now present to the two of you is, you know, talk to us about who our frontline workers are, right? And what are the mental health supports that are available to them? But let's go ahead and see where everyone's coming from. So we have a number of practitioners here on the call, as well as a lot of people who situate themselves as other. But then we have, you know, more than 1/3 of people between academia, advocacy, and administration. And we've got some policy folk here. Yeah, so we have quite the breadth of representation here. Thank you all for that. That situates us well. So yes, can you talk to us about the supports to our frontline workers, and then also help us to identify who constitutes frontline worker right now, and how we can be mindful of supporting their mental health.
So I would say excuse me. Sorry about that. So I would say that our frontline workers, our EMTs, our emergency room physicians, nurses, ICU nurses, our law enforcement, so many to name, and every day that they are putting their lives on the line in order to help flatten the curve. I'm a psychiatrist, and I guess I would also consider myself frontline, but I'm not meeting the person right when they come into the emergency department. I think that our frontline workers in terms of the ER physicians and nurses and those patients who are needed to be triaged to the ICU, those are the individuals that are probably seeing more of individuals who have tested positive for COVID and now are maybe ending up on a ventilator, or they're having to pronounce that person unfortunately is no longer going to be with us because of complications. But I think it is important that I'm glad that you mentioned this question, Mia, because one of the things that while I see that there is going to be a rise in the rates of depression and suicide and anxiety among people who, among maybe all of us, who we're all susceptible to this. Again, it's one of those things where we have to be mindful of how we're feeling and the types of things that we're implementing to help cope. I think the healthcare providers are also susceptible to rates of trauma, increased rates of trauma, as well as suicide, depression, and anxiety. And so I think it is important that we have resources in place to make sure that people know that they are, that we validate how people are feeling, and two, to know that they are not alone. One of the things that I have found helpful in our department, we on a weekly basis have been doing almost like a process group where we engage in mindfulness meditation, and we actually talk about how we're feeling. It's one thing to do virtual meetings. A lot of our meetings right now in our department have been done via Skype, but I'll be honest, I'm an extrovert, and so I miss that social interaction. I miss sitting in a room with my colleagues and saying, how are you? And so I have found the process groups and the mindfulness meditations to be beneficial. There's an app that I would like to draw healthcare providers' attention to. It's called Headspace, and it is free for any healthcare provider. And they have different exercises that you can do. Self-disclosure, I did one before our webinar today, just to prepare myself and to be mindful of how I'm feeling during this time. So, apps, there are different resources on various websites, including NAMI, the American Psychiatric Association, the American Psychological Association, the American Medical Association, which Mia, I know you and I have been a part of for many years. And so those are resources that I think can be helpful for those on the front line.
I have to give it also a shout out to Headspace. I use it as well. So do your thing. Yeah, Lenata.
Yeah, I think that's those are great resources, and Frank made such great points. I think that since Frank did such a great job of pointing out the essential workers, I would like to support and give a little diversity to also speaking to what our key workers look like. And, some of the people that are essential to this work are also I won't say less heroic, but have less prestige. And that is also to the janitors and to the nannies and the people that are still cooking and making food in restaurants and still doing the things that are producing these unintended consequences that allow us to still remain essential. And I think that's it's great to have colleagues like Frank and myself that can add to the robustness of this conversation, because it really takes a lot of people to do very small things. And I think that some of the things that are needed within the supports are some of the technical things so that they can psychologically feel safe. So if you're someone that is essential, quote unquote, then making sure that if you have access and privilege, how can we scale out some of our empathy and make sure that some of the people that are doing this work have access to masks, have access to gloves, hand sanitizer, cleaners that are now going into a shortage. And that's a very hands-on way that we can all start to tap into the different levels of privilege that we do have, and also supporting. So I think that if you're listening and you can, just know that we all are some type of resource, and we all have something that we can lend to this group of people that are doing this work daily. And it can be in a way that's sustainable for you and your family, but also just knowing that donating, if you buy a mask, donate a mask, but something that's very one-to-one contact for the people that are allowing us to be able to sustain this work. So I think that's important to say. Also, I have seen a lot of celebrities extend their privilege and talk about ways that they're able to give access to things. So, for example, Taraji P. Henson has the Boris Lawrence Henson Foundation, which is offering at least 5 sessions of mental health counseling for people that aren't able to afford this. And I'm a part of a group practice that is participating in this. So I think that the Capitol Hill Consortium in Washington, D.C. is a part of that process. And there are a lot of other mental health therapists and also to social workers that are doing this work and allowing their services to be either pro bono or giving a set amount. And I think that that is something that's okay. You know, it's okay to sustainably give out something that you're able to scale your empathy, and to also recognize that there's so many people that are doing this work. And also, I think it's a great time because you can, you can be a celebrity. This is a great level, like worldwide. We're seeing how everyone has access to the same air and living conditions, and that when we are all hurting, we are now, with a different mental model, able to see our humanity and how interconnected we truly are during this time.
You know, I want to just highlight a number of things that you both mentioned, but really quickly, just to shout out again, because someone is asking with the mental health app that Frank mentioned, Dr. Clark talks about the Headspace. And so it's just one word, Headspace. It's really cool. You can set up meditation times for 10, 15, or 20 minutes. And some meditations are 3 minutes, depending on, you know, what the topic is. But let me go back and Lenata mentioned, break up something that you mentioned. So I really appreciate this concept of scaling up your empathy, or scaling up one's empathy, right? And one of the things that I've learned in my meditative practice, and I'll also disclose that I practice yoga, predominantly hot yoga, and I've been practicing for a little over 8 years now. And one of the things that I know when I'm particularly anxious to do, when I'm anxious, is to try and ground myself in empathy and also in gratitude. And this is another question that we can get to later, but I just want to make a plug for one concept I live by is grace, space, and gratitude, giving myself grace and feeling okay with whatever anxiety is besetting me at the moment, space to really, I'm grateful that I have space to really think about and ruminate on it, as you said earlier, Lenata, and I recognize that as a privilege. And then gratitude for this opportunity to address my whatever anxieties or worries head on. But another thing that's also helpful, to your point, Lenata, is being of service to others. And that is certainly, there's science behind this. There are anecdotes behind this that say, you know, when you can one way to remove yourself from your own worries is to ground yourself in the life of someone else and practice empathy, scaling up empathy and putting yourself in someone else's shoes. And it truly is helpful for that other person, but then the residual is that you also feel less anxious. And if it becomes a practice and a habit over time, then there's some serious benefits to that. So I appreciate you all offering these individual level tactics, and thank you so much, Dr. Clark, for elevating what you all are doing within your practice and encouraging the physicians to be mindful and to sit down in the midst of the day and really take stock of where they are. I want to pivot and talk a bit more about go from individual level interventions and what we can be doing to be supportive, and talk more about social determinants of health, which we've mentioned just a bit. And I would like to talk about it on a continuum in terms of the U.S. once we come up out of this, right, which, you know, it'll ebb and flow, but is the U.S. prepared? Is our health system and our public health systems, are they prepared to really scale up empathy, but then also really address the social determinants of health as it relates to the mental health experience during COVID-19, and the ACEs, or the adverse child experiences that have been present before this, but may be exacerbated. So tell us about readiness on a structural level.
So I remember years ago, one of my therapists said something that has always resonated with me, and she said, "Listen to what people say, believe what they do." And that's how I kind of look at our current state of affairs. Even pre-COVID, we have had a lot of lip service, I think, in our government about, oh, this is happening, we should pay attention to this. And it usually takes a crisis, unfortunately, for people to actually tune in and kind of say, oh, this is happening. And then when the crisis is over, then things go back to normal, and whatever normal means to that has a different meaning for depending on what you're facing. But I don't think we're ready. To answer your question, Mia, I don't think we're ready. I think we should be ready, but should is the key word. The social determinants of health have plagued our nation for centuries, and especially when it comes to communities of color. We know the statistics. We know that there is an unequal distribution of power, resources, and money, and the social determinants of health impact how quality of life. We talk about longevity in our communities, especially Black and Brown communities. You can't have longevity without health. I, as a Black male, my life expectancy is about 70 years old, depending on where I live as well. So zip code matters. We know that zip code is more important than your genetic code. And so these are all things that have been talked about, again, for decades in our government. But I hope, unfortunately, when we have pandemics like this, for me, it just further illuminates the social determinants of health, or illuminates what we already knew. And so I think we have to do less talking and more action. So, obviously, everyone on this panel right here today, we're always advocating. I advocate, through organized medicine. I advocate at the state level. All of us are doing our part, but I think it's going to take more than just us on this call. We have to have a grassroots effort. We talk about connectedness. We all have to be speaking the same language. It's not enough for just people of color to sit at a table and they'll try to lend an ear, try to encourage our legislators that this is a serious issue. This is a public health issue. Not everybody can physical distance. We've a lot of mention about our frontline workers. If you're a bus driver, it's hard for you to physical distance. If you're an environmental service worker, it's hard for you to physical distance. Depending on what type of dwelling you live in, it's hard for you to physical distance. And so this goes back to the theme of structural racism that has plagued our country for centuries. And so I pray and hope that if there's any time, there's no time like the present. If we're going to make a change, it has to start now. We can't wait for pandemics to occur for us to kind of have a wake-up call to say, oh, maybe we should do something. So I'm going to continue this fight along with you and others and Alana on the phone, and to say, okay, enough talking. Here's the data. We know that this is happening. Let's form some task forces. Let's get a group of experts and sit at the table with the legislators and say, what are we going to do? What are we going to do to improve the health of our communities? The last thing I'll say, there's this old African-American aphorism that says, when white America gets a cold, Black America gets the flu. I saw something on Twitter the other day that said, they've twisted it a little bit now and says, well, when white America gets the coronavirus, Black America dies. We can't continue to lose people. If we're going to build sustainable communities, we have to make sure that we are doing the things and helping shape policy and and looking at the things that are at the underlying theme to how we got here in the first place.
Yeah, and I imagine that for those who have qualified themselves as working in advocacy and policy, that they really just took to heart what you just mentioned. So thank you for that. Lenata, over to you.
Yeah, I just, I appreciate what Frank said so much. That really touched me, because the idea that we get to pause, and I think to the root of what my colleague was sharing is that for us to be able to pivot and to move forward, there is a level of recognition of the historical trauma that's already been embedded in many communities of color. And we have to realize and recognize that some of our communities were already in a pandemic that was not televised, it was not talked about, and it was not a shared experience. So, you're living in a pandemic when you're not able to, in my opinion, address Maslow's hierarchy of needs and take care of yourself on a basic level. So if you are temporarily displaced from your home, if you're not able to have access to food on a regular basis, one of the things that are plaguing our children is that our school systems were a primary source of our children, for some communities, eating 3 meals a day or 2 meals a day. So the idea that you are not able to do this within the confines of your home and address that is a pandemic. The idea that gun violence and the things that are plaguing the traumatic incidents that are happening on an everyday basis, and you live within that neighborhood and you can't leave that neighborhood, nor do you want to leave that neighborhood, that is a pandemic and of violence that's been happening within different communities. So just addressing the fact that this doesn't feel like a crisis to people where your amygdala was already hijacked and you're currently in a crisis. So this doesn't feel like a new crisis. So I think that is one of the cultural disconnects that we're not saying and talking about, is that for many communities of color, for Native American communities, they already feel isolated, have already been social distancing on their land that we have, and that they can't leave. So a lot of these things for people that have family members that have been incarcerated, there has already been a level of physical distancing that has happened with our families, that people weren't able to get access to regular care and attention and love and affection. So I think there is a way that we can join these things by just recognizing that for many communities, we were already in a state of crisis. So layering this and now saying that we should be in alert, there is a huge disconnect. Well, we were already in an alert. So now what can we do to move forward? And I think that idea of being able to talk about that for many racial minorities in the US, having access to mental health has always been a luxury. It's been an afterthought, because when you think about those Maslow's hierarchy of needs of what your base cores are, if those aren't things that you can address on a daily basis, then it's hard to actualize to any other level of self-actualization and self-love and being able to connect in a communal way. So now that a lot of people are talking about the idea, well, now we have extra time. For a lot of people, it's not extra time. This is an everyday matter of, how do I still wake up and work? How do I still wake up and feed my family? So just thinking about the social determinants that were already pre-existing are now confounded and compounded for certain communities. So knowing that being able to have access to cultural responses to overcome these obstacles in these communities are really helpful. Being able to connect and understand that the level of bias that exists within our healthcare communities, and being able to combat that is really important, I believe, to move this conversation forward, so that it's not that we're still having these conversations that are based in race-based trauma that also are leading to PSD and exacerbating our already pre-existing mental health. So, we know that 1 of 4 people suffer from depression, and that can be both Black and Latina in our Black and Latina communities, and that they have higher rates of depression than our white counterparts. So just being able to say that now that we know this, how can our communities heal? How can we move this conversation forward? And when can we start to aspire to thriving? And I think that that is a possibility when we're able to say that now that we are on this even plateau of oneness, how can we now recognize the humanities in other people so that we're actually talking about mental health in a way to destigmatize it? I think forums like this help to open up a series of conversations that have been neglected within certain communities. I think also making sure that the mental health services are culturally appropriate and have a cultural responsiveness, and that also having a level of kindness to it, a level of kindness that we don't talk about often, that for Black men especially, not coming in until they have a physical manifestation of their mental health, that they're in pain, and being able to hear that. For other people, women of color, being able to say that I feel like this is wrong, and to be able to get medication for anxiety that's very underdiagnosed, and just being able to also for our religious communities. I think that Frank talked about it earlier, practicing the self-care and realizing that we also don't have to remove ourselves from our religion, but our faith communities also, it would be helpful if there was an intersectionality and we don't still make people choose. It's like making people choose their mental health. We can pray and go to church. You know, you can pray and stay at home and not go to church at this moment, and experience church online. So knowing that that third thing is just practicing your self-care and knowing that you're able to take care of yourself spiritually, but also keep your physical body safe.
So many jewels that the two of you are dropping. I almost wish we had more time. We have a little less than 20 minutes. I'm going to ask two more questions and then pivot a little bit. First and foremost, let me also just say, because you brought up the spirituality aspect, and again, as we identified earlier, wellness, especially when we're talking about overall wellness, is very much also grounded in spiritual wellness. So Ramadan Mubarak for all of those who observe and are fasting today. And so I just hope that your mind is clear and you're able to really ground yourself in that, and blessings to your families. The both of you were also talking about trauma and the presentation of trauma, the diversity in the presentation of trauma for different peoples, including little peoples, children. And you are both parents. Frank has the cutest little girl. I love her little chunky cheeks. And Lanata has a preteen, So if you two can just talk to us about ways that parents and people who are in proximity to children, or are social distancing, but have children in their lives, what are some suggestions to really engaging children in conversations in a clear, honest way about COVID-19, even conversations with respect to death of loved ones and distance, and then talk to us about how trauma might be presenting amongst children and what are some signs to look out for. And trauma can be anywhere on the ACEs continuum. And I'm saying ACEs, and again, ACEs refers to adverse childhood experiences. It could be anywhere from food insecurity to violence, to neglect in other ways. And if you're looking for additional information on ACEs, I suggest that you watch a really cool TED Talk that the Surgeon General of California, prior to her current role, gave. Her name is Nadine Burke-Harris, Dr. Nadine Burke-Harris. Maybe Keiko can find that video and put it in the chat. Mm-hmm. But on to you.
Mm-hmm. Well, I'll start. I think that it's really, I think it's really helpful as a parent to be able to recognize the levels and the diversity within our own range of emotions. And I think that right now is a time to talk about how you're feeling with your child. It's a very simple thing, but I think showing your child a range of emotions and letting them know when you're not having a good day, and not letting them see this perpetual idea that I always have to present as well. One of the things for my child is also fits into the category of being non-neurotypical. And one of the very, very hard things for parents that have children that are non-neurotypical is the break of their routine. It's a very hard idea to understand why I am in the house or why I can't leave the house every day. And understanding that it's okay for parents that have children that might have diverse sets of needs to know when it's okay to take a break, when you know that you need a break, and planning for that break ahead of time. For people that are single mothers, I think forming and understanding that being in your home and confined to your home for certain people is not always a positive thing. If your home is something that you need to leave to get that break. So just being able to know that, and I'm saying that to just represent a diversity within the way people couple and the way people co-parent, knowing that this is a time where you are okay to know that a lot of the health statistics have been talking about what this looks like for social distancing. This is not a time where you should not co-parent with your other parent. This is a time where you still need to make sure that children are able to see their other parent and that you're taking that break that you need within that time to take care of yourself. And if you're not able to do that, to also build that space or build community if it's with another single mother, but knowing that this is a time that's very sensitive to disease, and we know that, but this is not a time where we're able to not have those pivots in those times. I feel like it's really important to share that with our children. Knowing that creating a schedule that they can visually see within the home is really crucial, and knowing that the schedule can be diverse. So within our home, we have an A day and a B day. So within that, having an A day where there are certain times that you do certain things, and the B day where you're able to do certain other things at another time, but having some flexibility in what this looks like as far as getting some type of physical exercise. So if it's, with the mask and you're walking around, if you have it and you can walk around your neighborhood or you can be in your backyard, but being able to have some type of physical activity, and then having, even on the schedule, especially for non-neurotypical children, knowing what they're going to eat. So like if you're able to get everything out to the minutia of what shirt you're going to wear, what we're going to eat today, and then what this day looks like, and then having your family time on that schedule. So it's really important for my preteen to know, when are we going to reconnect? I know that I'm doing this and you're doing that, but when is our time coming? So having something that your children can look forward to, like if it's a movie night, if it's a game night, if it's a freestyle night, but using this time where you can lean into their world. And the last thing I'll say to that is that it's very hard for children. And my child is not having a very good experience. So every night we are talking about how much he is not enjoying doing school online. It is okay. So I think a lot of times we have historically been taught our parenting style should be to say, well, no, you can't, you need to like this. So I think it's okay for us to remind our children, this is not something you have to like, and then model and repeat and tell them and share experience of times where you're doing things you don't like. So I'm like, I don't like writing my clinical notes. I have to write my clinical notes and doing my clinical notes when he's doing his homework. I know that every therapist just cringed just listening. However, but just being honest with your kids so that they know that there's a lot of things as an adult that we do that we don't like to do per se. And this is also giving them this experience, and then praise them, say, hey, I know you don't like to do it, but notice that you are doing it. I'm very proud of you, and giving them some type of reinforcement on the schedule that is consistent for them to understand, if it's praise, if it's good job, if it's a different treat for dinner, but just being very clear about we're all doing this universally together, and it's something that we don't want to do. And the last thing I'll offer too is maybe using this time to learn a new thing with them. Maybe it's learning what game they're playing, learning or showing them what game you used to play. Apparently my preteen did not know what a Game Boy is. So using this time, all children should know what a Game Boy is now.
We'll quote you on that. All children should know what a Game Boy is. How about you, Frank? How are you working with your daughter?
Well, I appreciate Lanata's comments, and I echo her sentiments. So our daughter is going to be 16 months in 2 days. So at this point in time, I'm thankful her daycare has still been open. I actually thought it would close down, but she is able to go to daycare every day. And but it's still difficult. My wife is also a mental health professional, as a nurse practitioner in psychiatry. So, two people in healthcare can be busy, obviously, and then coming home and making sure we make time for her and making sure we're attending to her needs can be difficult. I'm right there with you, Lanata, in terms of notes and extra time spent on the electronic health records can be burdensome. One of the things that I think that has been helpful for me and my wife Jennifer during this time is we talked about gratitude and acknowledging how we feel. I think oftentimes it is important. Well, all the time, I think it's important to model for our children. Yolanda brought up about, it's okay to have a bad day. My daughter has seen me cry when I'm stressed, and that's okay. Now she may not know why daddy's crying, but when she gets older, if she sees me cry, I want to be able to say to her, daddy's just having a tough day. Daddy's going to be okay, but I want her to know that it is okay to be vulnerable. And I think especially during this pandemic, we're all vulnerable at different points in our life, but especially during this pandemic, some days are better than others for us. And I think this is also a time where a lot of people are grieving for many reasons. I mean, people are losing people as we speak. 50,000 deaths right now as of today. And I suspect, unfortunately, that there are going to be more. It's a difficult time in people's households. And again, everybody's going through something. And I think flexibility is important. Sometimes I think it takes a crisis for us to realize how rigid we are in our routines. And I have found, especially during this time, that I've had to be more creative. I like to write poetry. I like to express myself in different ways, but it is sometimes difficult. No one wants to see their children hurting. But if our children can't see us express emotion, how can we expect them to express how they're feeling? Our children look up to us. One of the other things I think is important for parents and who have children especially is to practice those positive affirmations. I'm a firm believer of self-compassion and showing ourselves grace. And oftentimes during stressful times, we kind of get into our own imposter syndrome, and whether it be as a parent, as a healthcare provider, whatever your occupation is, it's easy to sometimes just kind of filter in those negative thoughts instead of the positive thoughts. And so one of the things that my wife and I have been trying to do every day is talk about one thing we're grateful for. We're grateful to wake up this morning. Tomorrow's not promised to anyone, and I think we sometimes take things for granted. Trauma presents in different ways. One of the things that I've been, when this pandemic first hit, one of the things that I was concerned about was, I think we mentioned it earlier, of how, students, sometimes the household is not always a safe environment for children, right? They leave the household and they look forward to going to school because they know school may be the only safe, a sanctuary for them. And usually when they go home, they're being abused. And one of the things with, schools closing, it's been talked about a little bit, but I think it could be illuminated more in the media about the rates of domestic violence. And we talked about ACEs. We know that whether it's household dysfunction or any type of abuse, that increases your risk for developing a mental illness. It increases your risk for overall, poor health outcomes. And so it saddens me that unfortunately, I think the rates of abuse are going to go up with this whole physical distancing thing and schools being closed. And so I think for children who do not have a safe household, of looking at other ways that they can feel safe. And I don't necessarily have a lot of solutions for that at this time, but I think it's something important that we should acknowledge when talking about various forms of trauma and what that looks like for the individual.
Thank you both for that. I want to bring in the audience again with a poll question. Lenata and Frank told us how they're feeling, how they're dealing in their household. We want to know how you're doing. So tell us about your overall mental health at this time. Where are you? And remember, this is anonymous, so we truly appreciate your vulnerability here and your openness. In the meantime, I'm going to read some words from a poem called Antidote for Chronic Pandemic. And I'll, in fact, read the last 3 lines of this poem because it was mentioned that poetry is helpful. So the last 3 stanzas of this poem are: spread antibodies to neighbors to boost a system salivating for rejuvenation. Spread infinite hope via handshakes that embrace diverse narratives. Spread 6 feet apart to make room for wisdom, gratitude, and love contagion. And these words were written by none other than Dr. Frank Clark, who is sharing his poetry, and it's really helpful. So thank you for that, Frank, and thank you to you all for sharing your words here or your feedback here. So overall, people are feeling okay. It looks like, somewhere between somewhat good, average, and a number of us are feeling poorly, and so we're really hopeful again that these resources that we're presenting today, these words, are just affirming that we're in this together, as both of our panelists have said, and we really look forward to continuing conversations with you in the future. I'm going to just raise one final question for you all, and you've somewhat answered it, but maybe you can go into a bit more detail. What have you learned about yourself during this pandemic thus far? About your needs, your desires, your frustrations, what we need as a society, but we'll start with centering you in the question.
I think that this is the second panel I've been on that's asked me what I need, and I just appreciate that, because I think that as mental health professionals, we are called to ask that question of so many people, and there's not a lot of times where that's a forward-facing question of what do you need, or what have you learned about yourself during this time. And I have learned, I think that I've shared that I've learned how to scale my empathy, but I've also learned how to build community. And I think reestablishing what that looks like in the interconnectedness that I have to other people. I think that there's an assumption that because we talk to our family members on the phone, that we know what's happening in their life. But I've learned how to use Zoom and so many other platforms to have family game nights with people that are in California and St. Louis and in different states. And I'm stuck with the question, like, why didn't we do this before? Like, why didn't I think of this? It was very low-hanging fruit, yet it didn't seem obvious to me. So I've learned how to build community in a very different way and expand myself. I think, too, I've had some time to see my parent-child connection and learn just the depth to like how much just human personalities change within months and seconds, and being able to really foster and get to know the person that is in my home that I live with in different ways, and learn different things about someone else that's around me. But I think also to my own trauma, into my own pieces of my own mental health, I'm a very big proponent of being a receiver of mental health services. And the African proverb that really resonates with me is heal or heal thyself. And I've been always very clear about what this looks like as far as my own mental health journey being a very parallel process that I get to experience within my own self, and being a big subscriber to my own mental health. And it makes me a better practitioner to know that I never want to metaphorically be the dentist that pulls their own teeth. I need to also understand how to take care of myself. So I've had a lot of time to expand what it looks like spending time with my therapist on this platform, and also understanding what my needs are. So I've been able to say, you know, I had a personal to-do list with my son that I was supposed to order a cello that has just been lingering for shamefully almost 3 years. I ordered the cello last week. Now, that's just a small thing that I was supposed to do, that even my little one kind of pointed out, like, Mommy, it just took you so long to get to that. But I think it's okay. So if you are in the space where taking care of yourself looks like understanding what your mental health is, why it's important, but also just being able to reflect and reconcile if there was old goals that you didn't get to. That's been one of the ways that I've had to take care of myself, and onboarding and supporting myself so that I can be open and available spiritually, mentally, and physically.
So I alluded to this concept of gratitude earlier, and during this time, one thing my therapist is always she says this during our every session, and it's find the silver linings, Frank. What are the silver linings? And that has resonated with me pre-COVID, and now as we are as this pandemic is ongoing. We have a lot of luxuries that sometimes we forget, and even my wife and I were talking about this the other day. We were big movie goers, and we try to plan our date nights and go out to the movies. And obviously, right now theaters are not open, but we've had to be creative. And sometimes I think it's easy to take for granted those luxuries, so to speak, going to the movies or going to the YMCA. In times like this pandemic, I've talked with friends and colleagues. I'm reminded of my brothers and sisters in Haiti who have very little, but feel very blessed and are appreciative of what they do have. And so I think during this time, I have been able to reflect on what's really important, family. And friends. I just celebrated my 39th birthday yesterday, and I'm thankful.
Happy belated.
Thank you very much. I'm thankful for that. And I had a Zoom party, and to Lanada's point, I didn't use Zoom unless it was for meetings, but it was fun, even though I couldn't actually be close to someone, right, from a physical distance standpoint. It was cool to see the many faces who I call my friends, my brothers and sisters, to be with me for 40 minutes. We were able to fellowship with one another and just catch up. And it felt, it felt like we had just seen each other. It felt like it hadn't been maybe, 4 or 5 years since we had seen each other. And so we have to be creative. That's what I've learned during this time. And creativity brings about new ideals, and we think about all the creative minds in this world. Look what they have produced. We are all unique, and we all have spiritual gifts. We just have to dig deep and explore those. My wife and I are going to be taking up doing puzzles. I just ordered a 1,000-piece puzzle, so we'll see what happens. It may take us a year to finish it. I'm pretty slow when it comes to these things, but I look forward to continuing to practice gratitude, self-compassion, and just being thankful for the many blessings that are bestowed upon me every day. And that is my wife, my daughter, and then, the fact that I'm able to serve our communities each and every day. That is a privilege and something that I don't take lightly.
Well, it's truly a pleasure. I'm grateful for the two of you for all that you've offered today, for your time and your space, and thank you to your family for letting us, for letting us hold you for just a moment. As I mentioned, for me, this time is all about grace, space, and gratitude, and I'm holding that space. And in fact, I see Brandon is giving us the cue, but I wanted to potentially show you all my niece. Where's this baby? My sister just FaceTimed me during this call, and this is my munchkin, one of my munchkins, Issa. Say hello, Issa.
Precious.
Very precious. Yeah, okay. She likes her hands, but she's enjoying. Thank you all so much. I'm going to hand it over to Brandon.
In gratitude, as Mia said, I just want to thank you guys for sort of imparting your knowledge and sort of, I found this conversation today just very enlightening and very calming. I have a tendency to sort of worry about everything and just sort of, I mean, I've worked with all of you, so you know that I can be pretty pretty type A on a lot of things, but I just a little bit. But I just appreciate you all, and I appreciate you guys getting us, educating us this last hour. And like Mia said, I just want to end on a space of gratitude and say thank you. And I look forward to seeing everyone next week. If you have sent questions or anything, we'll try to make sure we copy this ahead of time and get to our experts for some answers. And Keiko, the great Keiko, she'll make sure that this presentation will be on our YouTube page soon. So thanks again. Have a good day.
Thank you, everyone.
Thank you. Thank you all for having me.
Stay safe. Bye.